Nissan Bulavanaka, Talofalava, Maloi Lile, Kia ora, Kia orana, and g'day. My name is Jioji Ravulo, and thank you so much for coming to today's launch event. Many apologies that I cannot be there. I am in Fiji. I've been here for the last week, and I've been working on various projects here, but I'm very proud to be involved in this new project that has been funded called Mental Health Talanoa. And what I'm going to do, I'm going to spend the next couple of minutes or so just giving a brief overview about what this project is about and how this project will hopefully assist our communities, the Pacific communities here in Australia, but also more broadly as we roll this project out. So I too, along with others, would like to acknowledge the traditional owners of the lands in which we are located, and pay my respects to elders, past, present, and emerging. And to further reiterate our ongoing collaboration and our meaningful desire to engage Indigenous knowledges across all components of the work that we do, including this project. It's within that context that our Indigenous perspectives should permeate this particular research project and will continue to be utilised as part of us having a broader understanding of what mental illnesses look like in and across our communities. Just to start with, I just also want to acknowledge my two other colleagues involved in this project, Ursula Winterstein, who I believe is there in that space. So give us a wave, Ursula. And we also have Dr. Shannon Side, who is our research officer. So Ursula is our project officer for the Mental Health Talanoa project, and Shannon is our research officer. And our project really has three key objectives. The first one is to really understand the broader, bigger picture of what mental illnesses or the prevalence of mental illnesses. So what sort of mental illnesses may be prevalent in our own communities in Australia. The second is to look at how we may have impact, or the impact of the morbidity, the way in which those illnesses impact our well-being. And then the third component is to look at how we can create better services to engage our communities. So let me just further go into the overview of the actual broader project. And you can see here that there are 4 phases that really reflect those 3 key areas that I just talked about before. And you can see it starts almost from the smaller part of formation, and then it moves up into research, education, and training. So it's within those 4 phases that we've created this project. And the idea here is it's almost like a fret, a small wave that goes back into the shore and out again, and it forms a ripple effect across the way in which we actually do things. And this is quite Pacific. I think there's a regional vision called the Blue Pacific that's happening across the region at this moment, and I think we in Australia are very much part of that. And so you can see that as we undertake each of the phases, they're not stages where we finish one and then go on to the other one. If anything, they meaningfully inform each other, just like the rippling waves of the ocean in which we are all connected. So I'll go through each of these ones very quickly, and then I just also want to further highlight that we're very much focused also on understanding the individuals, our families, community, and the systems in which we're also operating the project in and around. So formation, community engagement. So this is all about encouraging community engagement to occur, and for us, it's about the initial Talanoa process with government departments, peak bodies, community-based agencies and groups, including Pacific leaders. As a result of the funding which we've received from West PHN, Southwest Sydney, PHN, and the PHN, the Primary Health Networks, and also the New South Wales Ministry of Health. Thank you so much for your funding. We've now been able to create this initiative in and of itself. And the Mental Health Talanoa project will include steering groups and a reference group. So we have members that are being part of our steering group, and then our reference group will come from various people from across, again, our communities. So that's one of our initial phases, and then we move into the research. And in the research, we're looking at being able to create the first time ever baseline data associated with our community's experience of mental illness, its impact, and then also looking at how we support access to help, to support services. So that research will again be formed by the work that we're doing with community stakeholders, and again really trying to create scope to ensure that we're accessing information on and across our communities. So we're working with our communities, and we're going to be doing some surveys, and we're also going to be doing some Talanoa groups to, again, get a better understanding of what this all means. The education phase of our project is then to create sustainable resources for our communities and to provide scope for us to have a better understanding of what we call mental health literacies. So this is this idea of being able to develop our insights and perspectives on what mental illnesses may look like, but also how we as Pacific people perceive them, again in the context of our Indigenous perspectives, and how that actually then works in across ourselves, our families, our communities, and how that then also is responded to within the systems that we are surrounded around. And the fourth phase, again, they all overlap and they all work together, is our training phase. And this is where we're looking at workforce development, community development. And this is where we're encouraging organisations like the health departments and education and other key stakeholders to develop their own abilities to work with our communities. The responsibility is across everyone's, it's across everyone. It's not just up to Pacific people to engage in services, it's also up to services to develop strategies to engage our people. So this is part of that phase of being able to encourage people to be trained up and also to develop those particular skills. And so once again, the project is holistic in nature. We're trying to understand, again, individuals, families, community and systems that we work with, and to ensure that we are providing scope for mental illnesses to be better understood across our Pacific communities, across the diaspora in Australia, but even beyond. So thank you again for your support, and yeah, we look forward to rolling this project out across the next 12 months with you, that we are working with the various key stakeholders and of course our people. So we're working together to ensure that we can get positive outcomes. And please feel free to contact me. I'm contactable via the University of Wollongong alongside Ursula and Shannon. But thank you again, and I look forward to seeing the project develop, and enjoy the launch and enjoy the food. I'm sure the food's going to be amazing. And again, thank you for your support, and we'll see you soon.